So hello and welcome to this webinar hosted by Cancer Research UK as part of London Global Cancer Week. My name is Alex Wright. I'm the Head of Global Policy and Programmes at Cancer Research UK, and it's my privilege to chair our discussion today on combating health inequalities through tobacco control, domestic, that's UK, and global perspectives. First, just some brief housekeeping. We will be recording the session. And after our presentations, there will be an opportunity for some Q&A. So please do put questions into the chat box and we can post those to our presenters. So I'm delighted that we have a distinguished panel with us today. We have Malcolm Clark, Senior Policy Manager for Cancer Prevention at CR UK, who leads our domestic UK tobacco policy work. We have Nisha Arunitalake, Director of Research at the Institute of Policy Studies, a leading think tank in Sri Lanka and a partner of CR UK in our global work. And IPS have driven some really impressive tobacco control policy gains in recent years. And we also delighted to have colleagues from the Tobacco Research Group at the University of Bath. We have Phil Chamberlain, Rob Branston, and Sophie Brasnell as well. And the Tobacco Research Group at Bath, amongst other things, produces Tobacco Tactics, which is a source of world-renowned monitoring and analysis of transnational tobacco companies and their activities. So just to introduce today's session, why a session on tobacco control for London Global Cancer Week? Well, to put it simply, we can't address cancer either in the UK or globally without getting to grips with tobacco use. It remains the single largest preventable risk factor for cancer, as well indeed as for other non-communicable diseases. And it both reflects and drives socioeconomic and health inequalities in the UK and globally. And working in tobacco control, we also face a formidable and evolving opponent in the tobacco industry, which is determined to fight tobacco control efforts at every step, and does indeed manage to overturn some of the hard-won gains of the tobacco control community. And we'll hear today from colleagues about the tactics that they employ. It's also worth noting that this discussion comes at a crucial time for tobacco control efforts globally and domestically. In the UK, the tobacco control community here was delighted by the forthcoming UK bill announced by the Prime Minister to create a smoke-free generation. And the focus now in the community is on securing the passage of that bill into law, which will mark a real landmark moment. And I'm sure we'll hear more about that from Malcolm. And on the global stage, we are primed and ready for our next meeting of the Committee of the Parties of the WHO Framework Convention for Tobacco Control, the SCTC, which was due to take place next week, but it's now delayed until early next year due to the current situation in Panama. And just a word on the SCTC, it is a great thing. We are very lucky to have this widely adopted treaty covering key measures for tobacco control, and it's undoubtedly helped to drive global progress to reduce cancer incidence through reducing tobacco use. But much more does need to be done to support its implementation. And there are, questions to be wrestled with on how to keep the convention fit for purpose in an ever-changing world. And at the same time, we know the tobacco industry is continuing to target new consumers, especially young people, especially in low and middle income countries where regulation is often weaker. And we are in a situation where we're seeing tobacco use rise again in some countries. And I think just reflecting on that broader public health context, we are in a world where health inequalities are widening, both within and between countries, and tobacco is a key driver of those inequalities. It's still the leading cause of health inequalities in the UK, with a bigger impact than socioeconomic class. So regardless of the incoming smoke-free generation legislation, there are still significant challenges for policymakers and the National Health Service in the UK regarding tobacco. And globally, 80% of the world's tobacco users live in low and middle income countries, and the NCD burden overwhelmingly affects low and middle income countries in terms of premature deaths. And the tobacco industry, as I've said, exploits what are typically weaker regulatory and enforcement systems. I just wanted to highlight, actually, on Thursday this week, there is a new research paper from Cancer Research UK being launched, which does look at the impact of tobacco and 3 other cancer risk factors on lives lost to cancers across the UK, the US, and the BRICS nations. That's Brazil, Russia, India, China, and South Africa. So I encourage you to look out for the launch of that paper this coming Thursday. So I think at this stage, I'd like to invite Malcolm to present first and provide us with some insight into the UK context. Malcolm, over to you.
Thank you very much. I don't have slides for this, although I'm happy to, I say, have something circulated afterwards that does put nice imagery on it. But as Alex has said, I'm Malcolm Clark, the Senior Prevention Policy Manager at Cancer Research UK. And I see it is and continues to be a very exciting time for us and for the tobacco policy and tobacco control community in the UK. And I'm going to come to that in a minute. But first of all, I just wanted to briefly touch on cancer inequalities as a whole in the UK, then go to, I say, that specific role of smoking and tobacco, and look at its impact. And then I say then discuss sort of where we are now with government action and where we might go forwards with the general election coming up in the UK as well in the next sort of 13, 14 months maximum. So first of all, in terms of cancer, tackling inequalities in cancer, I think it's just worthwhile recognizing there are inequalities in every aspect of cancer, from research to cancer risk, screening, uptake and help seeking, through to the access to the health system, treatment and clinical trials. And these contribute to stark and unacceptable and unwanted differences in cancer incidence and outcomes. And some of the people and populations in the UK face higher chances of getting cancer and poorer experience of care and worse cancer outcomes. Indeed, we've calculated that cancer incidence rates are higher for people from more deprived populations in every UK nation, with more than 33,000 extra cases of cancer in the UK each year associated with deprivation. And it's people from more deprived groups, some ethnic groups, and people with learning disabilities, all are more likely than comparable groups to be diagnosed at a later stage for certain cancers. Throughout each part of the cancer pathway, including in terms of prevention, there are ways that we can tackle some of these inequalities in cancer. So I will go into more detail on the tobacco side. But it is also worth stating that significant progress will not be made without addressing the underlying determinants of inequality, such as poverty, housing, and structural inequalities based on a person's background or identity. For the UK, where I want to start is actually with something that one of our Cancer Research UK campaigners, a man called Colin, who lives in Lancashire in the north west of England, a reflection that he had and gave to Cancer Research UK earlier this year. Said, both of my wife's sons work in low-paid manual jobs and smoke. Our eldest grandson has now started working for his father and has also now started smoking. Unless we break the cycle of low-paid jobs and associated smoking, which is linked with these jobs, this culture and our impact and its impacts on lives will continue to haunt the next generation. Just in that one quote, you've got kind of everything. You've got, the wider social determinants, the the issue of smoking and intergenerational smoking itself, and you've got the fact of how do we do something to make the next generation healthier than ours. Preventing someone from ever starting to smoke will mean they avoid increased cancer risk. Most people who smoke have tried to quit, around 8 in 10, and they regret ever starting. And smoking is an addiction and people need support to stop. And given in 2022, around 5.3 million people in England smoked, there are significant gains to be made in helping people stop smoking. And then we will reduce it down to actually looking at, looking within socioeconomic groups. We really realise that not only is there nothing that would have a bigger impact on reducing the number of preventable deaths in the UK than ending smoking, but we also recognise that smoking is the single biggest driver of inequalities. Our analysis shows that nearly twice as many cancer cases are caused by smoking in England's most deprived areas compared to the least deprived. And our analysis also suggests that ending smoking could more than halve England's inequality gap for cancer incidence and reduced lung cancer rates would also play a significant part in reducing our inequality gap. If you look at the impacts of smoking, again, it is the beyond simply the health the immediate health aspect. It's also those in lower incomes and people in live in deprived areas who are affected the most. Financially, poor health can lead to a loss of earnings, and there's a more immediate impact on people's pockets. People who smoke spend on average at least £2,000 a year in the UK on tobacco products. We also know the impacts on our health service across the country in terms of smoking. 75,000 GP appointments could be freed up each month in England if the UK government put an end to smoking. There's an estimated around 500,000 hospital admissions every year in England attributable to smoking, and it costs the health service, significant amount of money, £2.2 billion into 2022 across the UK, and further falling on the social care system. So this is something that has a huge impact on people's lives, on the addressing or the failure to address inequalities, and on our society as a whole. But there is hope. Smoking rates fall when leaders take decisive action. The foundations are already there from what the government can do to end cancers caused by smoking sooner. The UK government has an existing ambition to achieve a smoke-free England by 2030. So that's where adult smoking prevalence is reduced to 5% of the adult population in England. But that ambition has not yet been matched by the firm policy action needed to drive the shift in the ground quick enough. On current trends, England won't reach its smoke-free target until 2039. And we know that people living in England's most deprived areas could reach smoke-free almost 3 decades after the least deprived. So realising smoke-free across all socioeconomic groups would be one of the most impactful and equitable actions for any government. Now, as I said, we're in an exciting place. Last week in Parliament, King Charles III confirmed the UK government will introduce legislation to raise the age of sale for tobacco, ensuring no one currently aged 14 or under can ever be legally sold cigarettes or other tobacco products. The announcement made in the King's speech during the state opening of Parliament follows on from last month's last month's Conservative Party conference, where Prime Minister Rishi Sunak committed to creating the first smoke-free generation. The Tobacco and Vapes Bill, which will be tabled in Parliament in the coming year, hopefully in months rather than later, will also include measures to curb youth vaping, and ties in with government plans to provide extra funding for local stop smoking services and invest in mass media campaigns encouraging people to quit. At Cancer Research UK, we've been tirelessly campaigning for this sort of action on smoking for a decade, informing and influencing the government to keep cancer at the top of their agenda and publishing research in support of our policy asks. Last year, we brought it all together in our Smoke Free UK campaign, with campaigners calling for their MPs, their members of parliament, to become smoke-free MPs. We're happy to see the UK government has been paying attention to this campaign, and we also want to see the devolved governments in Scotland, Wales and Northern Ireland follow this lead. So what has been announced and what could go further, could we go further? So the proposed legislation would raise the age of sale for tobacco in England by 1 year every year, permanently banning the sale of cigarettes or other tobacco products to people born on or after the 1st of January 2009. As it focuses on sale, it will not criminalise the act of buying tobacco and won't prevent anyone currently older than 14 from being sold tobacco in the future. This measure was first suggested last year in an independent review led by Dr. Javed Khan, which we and our partners in the Smoke Free Action Coalition informed and endorsed. And a similar law has recently been passed and implemented in New Zealand. But we know that, doing something for the next generation is only one part of what needs to be done. We need to look at what happens to those people who are currently smoking, to help support them to quit, and to have a wider context, a wider environment where smoking is less accessible, less attractive, and people don't start of whatever age. So that's why as part of the Smoke Free UK campaign, we've also been campaigning to get sufficient, predictable and long-term investment in critical measures such as smoking cessation services, public health campaigns and stronger enforcement of existing and new restrictions. We welcome the UK government's recent pledges of new funding for these measures and services as a significant step towards this, but we know that, particularly with an election coming up, we need to ensure that that funding is secured, not just for the next year or two, but for the life of the next Parliament until we get to smoke-free across all our socioeconomic groups. That's why in a couple of weeks' time, Cancer Research UK is launching a manifesto for cancer research and care. This will be across across the cancer pathway, what actions we would like to see the government do in the next parliamentary term after the next election to support cancer patients, but also particularly to prevent more cancers. And in that report, we are bringing together a lot of the work that we have already done, and we'll continue to push and campaign on around the measures needed to to reduce the appeal of continuing to smoke, prevent people from taking up smoking in the first place, looking at the ways that industry has adapted in the past to regulation and trying to close some of those loopholes, and whether this is on tobacco flavors, packaging and health warnings, packaging and brand names, looking at something going through at the moment on government on pack inserts, or other more novel ways that the UK government could put in place measures that could deter people from starting to smoke. These are the things that Cancer Research UK, I say, has been doing policy development on. Will continue to provide the research and the policy development to support both this government and future governments to ensure that we get to a place where we bring those smoking prevalence rates down, so that we are smoke free, not just across the population as a whole, but all socioeconomic groups, because that is, as I said, is the really important place that we need to be for for everybody in the UK. Thank you very much.
Thanks, Malcolm. Some really striking, I think, statistics there about tobacco and inequality in the UK. I mean, a 3-decade difference between reaching smoke-free at current rates between upper and lower socioeconomic groups is really, really staggering. I'd also just take this opportunity to, as Malcolm mentioned, our forthcoming manifesto for cancer research and care that will actually also include some calls for what the UK can do within its global health policy to accelerate progress on global tobacco control. At this stage, I'd like to hand over to Nisha as we move from the UK to Sri Lanka, and we're delighted for your insights into the context there. Thank you.
Thank you, Alexander. So let me just bring up my PowerPoint here. Okay. Can you see? Okay.
Yeah, that's perfect.
So what I'm going to present here is some of the work actually we've been doing over the last 4 years with support from Cancer Research UK and QO International. Just to give you a background, Sri Lanka has a very mature tobacco control policies in place. It ratified the WHO FTCT in 2003, and since then there has been a number of initiatives to strengthen the tobacco control measures in the country. And also as a result, the prevalence levels have come down over the years. So the latest GATS survey that we have, it is down to 6.2% overall, and the male one has come down to 13.4%. It is actually mainly a problem for males in Sri Lanka, not for females. But still, as actually I was more than 12,300 Sri Lankans are killed every year by tobacco-related diseases. And the cost of, so the latest figures that we have is where a comprehensive costing was done for tobacco attributable diseases, both direct and indirect. And it came to 89 billion, which was 6.1% of government revenue. Actually, that year, that was more than what the government collected in terms of government expenditure, 6.1% of expenditure. It is more than what the government collected in excise taxes, tobacco and excise taxes, which was 5.5%. So this is a fact that we've been telling the government, because right now, you know, Sri Lanka is in this economic crisis still, and they are so focused on increasing revenue, but it is also costing the government a lot. So what is alarming is actually, as what Malcolm was saying, what we find in Sri Lanka is very similar to what was described for UK by Malcolm. The remaining groups of smokers are actually in these most vulnerable groups. So it's among the rural households in the lowest wealth quintile, and also like in UK, it's among low-skilled workers in low-skilled occupations. And also, it's 68% of the current smokers had initiated smoking before the age of 21. So these are actually our tobacco control program with Cancer Research UK. It was, the name of it was Going the Last Mile. So actually, we have smoking happening in these pockets. So what we need is to, so current policies in place actually don't reach out to these different groups, because I will explain why that is the case. So I think we need to have more focused attention, different types of policies to reach to these different groups. So one thing we see is, initially when the excise tax was introduced in Sri Lanka, the tobacco company started lengthening the cigarette. So there is like tax per length of cigarette. So the policy was changed. Now there are 5 different taxes by length of cigarette. But what happened is actually, if you can see, the tax rates for the lowest lead cigarette, which is also the cheapest, has really not changed so much, whereas for the higher lead cigarettes, it is going up. So there will be a big announcement in the newspapers after the budget. Actually, our budget was read by the president yesterday, that the taxes will increase. But when you really look at it, you will see the lowest lead cigarette not actually sometimes increasing at all. So this is a bit of a concern, because this is the cigarette that people start smoking with, because that's the cheapest available in the market. And it is also the one that the poor, more vulnerable people go to because it is the cheapest. So that is some of the work that we are doing, is try to change this and have a uniform tax everywhere. So we know exactly when we say tax increase, that it is increasing for everything, not for some. It's not. Okay. So moving on to how the tobacco industry is interfering with tobacco control measures. So they have this false reporting in media. If you see in this graph, the total revenue has been as a percent from excise and tobacco has come down as a percent of total revenue over time, but tobacco industry builds this image as if it is the greatest contributor to tobacco revenue. And it also says usually just before the budget is being read in Parliament, you see these newspaper items that coming up about how smuggling is high in the country, and that is taking away potential revenue the government could earn, and also the informal types of tobacco, BD, prevalence is becoming high because the taxes are increased. So especially this year, we see that these actually, I have been in touch with the Parliament relating to some committees, and even some of the ministers are saying these things that, because this year actually tobacco taxes were increased twice by 20%, once in January, once in June, partly because of the economic crisis and also what we have been advocating through our tobacco control program. And they were saying, you have to be careful because the smuggling will increase. So these are all is false information that is fed to the parliamentarians by the industry. They also lie about the number of tobacco farmers, which is, according to the agricultural ministry, is 3,000, and they claim it's 20,000. So another way that they're interfering and actually reaching out to the young people is through social media. So they use different claims. They advertise in social media. So at the moment, advertising on tobacco advertising is completely banned in Sri Lanka, but they do this using social media, and I think the government is not able to do anything about it because our legal system is not sophisticated enough to identify the perpetrator and take action. And also they make fun of non-smokers. So in this first one, which is in Sinhala, which says that if you want to get friendly with a girl, you need to be smoking and drinking. So that's what it says. So they have this kind of sort of cartoons in social media trying to have this image of it is cool to be smoking and these kind of things. And also they use popular actors and images of them smoking. So also to try to incite these young smokers and people using social media. Another way they are interfering is, they are pretending to be a company which is doing a lot of CSR activities and livelihood of the farmers, and then empowering villagers. So that's another way that they're interfering. Lastly, actually, the interference is very high levels also. For example, the actual implementation of FCTC was delayed because of their interference. And we have an initiative called the Tobacco Free Zone Initiative, which is by the public health inspectors who have zones where they are responsible for. They try to make it tobacco free. But there's been these people, especially the inspectors who are very successful, have been harassed and threatened by the industry to stop their actions. They do that on one hand, and then on the other hand, they try to support the retail shops which are selling tobacco by recognizing them. There was a program called the Abhisheka program, which actually recognizes these retail shop owners who are selling tobacco. And recently, as you see in the picture now in Sri Lanka, all the cigarette packaging has 80% of it has to have this pictorial warning about the health warning, and in all 3 languages. When this was implemented in 2012, just before that happened, the health minister at that time, Mr. Sirisena, he became the president of the country later on in 2015. He claimed that actually the industry bribed him to not take this, implement this law. But, and also later on, he was actually taken to courts by the industry. So they go to that level to try to stop these things from happening. And we also see tobacco industry officials in high-level government positions. So they have direct ways of influencing how the tobacco control activities and the policies, how they're implemented. So lastly, I just want to, through our research, I mean, we were interfered with by the industry. So they approached the junior researchers who are working on tobacco control issues and try to befriend them and try to get them to falsify the way they are conducting research. That's one way. And they have threatened the enumerators and threatened action, got them to go to police and put them in jail almost. So we had to get the help of STOP to try to stop that from happening. And then also they regularly refute research findings if you publish anything that is refuted publicly. So it's been a struggle. So yeah, I'll stop there. I'm happy to answer any questions if you have.
Thank you, Nisha. I think we'll move on to the team from Bath in just a second and take the questions at the end. But again, I think a really sort of sobering report, really interesting that it's the situation with regards to inequalities is bears some real similarities to the UK. Again, really struck by the cost of smoking to the government in the context of Sri Lanka and other low middle income countries. It's really a reminder that on both an economic and a social level, that tobacco is a development issue. It's not just a health issue. It really does put a brake on the overall development of a country. And then, as we move to the team from Bath to talk about the role that and the tactics that the industry employ, again, really striking to hear just the lengths that the industry go to, down to interfering with your own research. So it's not just the sort of the high level sort of PR exercises, but really trying to disrupt other actors. So thank you so much, Nisha. And at this stage, I'd like to pass over to the team from Bath. Phil first, I believe.
Yes, Alex, thank you. And thanks everybody else for joining. I'm going to do the dreaded try and share my screen and see how that works out. That seem okay. Getting the noddings. So nodding is always a good sign, I think, at this stage. So thank you, and I'm hoping this will complement the two excellent presentations so far, and welcome questions afterwards. And Rob and Sophie, who join me, will be chipping in as well. I'm going to try and give an overview, if you like, of some of the activities for Tobacco Control Research Group. It's relatively high level on some of the areas we're looking at, but and also where we should be looking at. A question posed back to our audience, perhaps. There's some details there on our conflict of interest statement. We are part of the STOP initiative, which is a global watchdog on tobacco funded by Bloomberg Philanthropies. We're a partner in Bloomberg Philanthropies, along with around 16 other organisations, from Johns Hopkins University to WHO, Centre for Disease Control, Tobacco Free Kids, and others. And we've been working for over a decade now, looking at the activities of transnational tobacco companies, thinking about their tactics and strategies, and trying really to put that into a framework of understanding, so that we might be able to better predict and understand where they may be acting, but also how that can be applied to other unhealthy commodities as well. And our multidisciplinary team has skills in a number of different areas, research areas, and that research base is at the foundation, even if we publish and have outputs in a number of different ways, as well as journal articles, but a number of different outputs. And we've got a rough sort of logic model we put up there in terms of our activities and outputs, the sort of range of things that we look to do, and where we look to have our reach with that impact around increasing that denormalization of the industry as it looks to get a seat back around the table, to push back against the FCTC. Article 5.3 looks to be involved in decision making, increase that accountability, that transparency, the roles we can do with that, and increase skills. We'll be able to share knowledge and skills with colleagues from other countries as well, so we're able to support tobacco control and research elsewhere. Very much thinking sort of at a global level, with that objective of looking to produce a decline in tobacco use rates. And we see from the range of outputs we've got, and I'll go through some of those examples coming up, that we're trying to have that understanding across a number of different areas, thinking that people consume information and think about the information they need and pick that up in different places. So I'm going to look at a couple of different examples, and that research base is at the foundation of the work for the Tobacco Control Research Group, and we're looking in areas from mapping about the manipulation of science to the language used around industry transformation. I think that Lisa's example there on intimidation will be of interest to our researchers, looking at that issues around intimidation of public health researchers. One particular strand is on taxation, which is my segue now to Rob to talk about that particular strand of research on price and taxation, which Rob leads on.
Thanks, Phil. So, I mean, we have been working in a whole host of issues around pricing and taxation to really understand how the industry is looking to maintain their position going forward in an environment where countries such as Sri Lanka and the UK have been progressively increasing their taxation. And we've done work identifying how the industry responds to increases in taxation, the 6 broad strategies they look to deploy in order to minimize the impact of taxation on markets, and to try to make sure that they can continue to have cheaper tobacco products available on the marketplace, because the industry knows cheap tobacco is the route to getting the next generation hooked. So just as we saw in the Sri Lanka presentation, this idea of there being these smaller, cheaper cigarettes still on the market thanks to the tax system, the industry looks to maintain that even when the tax system doesn't give them that advantage. So we've been looking at that, and also how the industry uses the illicit market where it can't undermine taxation, for example. And ultimately, the idea that industry is looking to maintain their sales because of the profits that the company is able to earn. So we've also done some work looking at profitability of the industry and how they've been able to maintain this profitability over time. So quite a varied exploration around this key topic of pricing and taxation.
Rob, thank you. I'm going to move on to another particular output, which Alex mentioned before, which is on tobacco tactics. Just having a look now if it wants to actually move my slides on. So Tobacco Tactics, established just about a decade or so now, has around 900 pages of profiles of either industry tactics and strategies overall, maybe around corporate and social responsibility, or perhaps particular individuals, organizations, front groups, allies, looking to show with a strong evidential base what those links might be and how they operate. Perhaps seen most recently where the first responses to the proposal for a smoke-free generation bill generated perhaps predictable responses from Institute for Economic Affairs and Forest, and perhaps still surprisingly, even if we may be familiar with the backgrounds of those organisations, that they can get media airtime without any health warning about who their funders are, or indeed if anybody knows who the funders are, because they're so opaque in their funding. And Tobacco Tactics provides information on organisations such as that, so that people are able to be informed and policymakers are able to be informed about who it is they are dealing with, and indeed sharing the background of organisations such as Forest as well. And that's an ongoing effort there to sort of chart that industry transparency, if you like, to provide that transparency for the industry as well. One other aspect in terms of building on our research skills within the big data is around a supply chain, a relatively new initiative from us, which Sophie is going to talk to here.
Thanks, Phil. Yeah, we often think about the tobacco industry. We think of our big names, our big transnational tobacco companies, Philip Morris, British American Tobacco, or big brand names of tobacco products. But in reality, we know that tobacco products are the result of activities from multiple different companies around the world, including, agricultural-based companies, paper companies, not just those names that we come to know so often. And these companies all sit along the tobacco supply chain, from growing that tobacco to disposing of those tobacco products. And this project has been several years in the making, and our work on the tobacco supply chain really is a sort of perfect demonstration of how we in TCRG try to combine research, data gathering, and the communication and presentation of information in new and diverse ways. And in this project, we specifically created the supply chain database, which brings together data from international trade data and company data from literature, industry magazines, industry websites, and company reports, annual reports, investor reports, and all sorts of sources. So it's a really large piece of work that spans the entirety of the TCRG team. And from this, we've done the usual, we've created research outputs and a number of academic papers. But beyond that, we've gone further to make this database freely available, easily accessible, and interactive on our Tobacco Tactics website, which enables people such as yourselves, tobacco control researchers, advocates, to actually understand what the supply chain is, where it's located, and who is involved. And ultimately, this allows users to identify and understand all of those actors and all of those companies along the tobacco supply chain, both at a global level and at a country-specific level.
Sophie, thank you for that. Another example of some of the research we've teamed up with Vital Strategies, a partner as a Bloomberg partner, commissioned research about Formula One and the involvement of Philip Morris and British American Tobacco there in terms of funding Formula One. You still think that sport has mostly managed to sort of kick tobacco funding, but actually within Formula One, so quite eye-watering sums being spent still. And when you talk to journalists and they say, well, I don't understand, what the problem is, cars zooming around, 100 miles an hour, no one's going to see this. Well, I tend to suggest that if the industry is going to spend millions and millions of dollars, it sort of knows what it wants to be able to do with that. And the latest research in there showed that it was getting incredible amounts of free advertising via the Netflix Drive to Survive series. And we may have national restrictions on tobacco advertising and promotion. Actually, that's being overridden by these sort of cross-border global sort of media events as well. So a sort of example there where the industry is using whatever vehicle, pardon the pun, if you like, to be able to kind of get through legislation and sort of get around what may be kind of national restrictions. And with the Formula One quite happy to sort of take that money. So trying to think about where we can identify where there are global areas which need to be addressed in terms of tobacco control. Just want to pick up now on in terms of that capacity building. So this July we had our tobacco industry monitoring research and accountability course. We've been running that for several years now. We had 48 people from 33 different countries, 29 of them from low and middle income countries, trained for a week at the University of Bath. Been running it yearly in July, looking to train them in some of the areas that we work in, so that we're able to sort of pass on some of those skills and form relations and connections with people from different countries as well, so they're able to supply, to share information techniques and build up that network, because there's very much, I think, as we're looking at transnational companies, we're looking at transnational sharing of information understanding as well. And we'll be running another course for 2024. Just a quick shout out for a film that a documentary we've just been collaborating with Professor Roy McConaughey from International Development at University of Bath, just released in the last couple of weeks, looking at the neocolonial aspects of tobacco farming, relations with Imperial based in Bristol and tobacco farming in Malawi. And that's something which we have done screenings in Bristol and New York, and we're planning others in Nairobi, in Brazil, India, Pakistan and Sweden, and we'd be delighted to link up with colleagues on this call for other showings. I think it's really important to explore these areas around exploitation in terms of tobacco farming and some of that impact and that accountability for those transnational companies in that supply chain as well. So that's a slight breather from me as I sort of rush too far. I'm just going to move on to this last bit now. So one of the areas around industry transformation for us, and I think a growing a sort of grey area as it looks to change its skin, change its story, shake off what it feels to be, shake off the stigma attached to it. It's broadening its portfolio, so it's moving to areas, picking up pharmaceutical companies or picking up cannabis areas. We've seen most recently the Foundation for a Smoke-Free World, probably the best funded front group in history in terms of tobacco, divorcing from Philip Morris, but with a divorce settlement of $122 million. So that should keep them going at its current rate until 2029. I mean, just incredible sums that they're able to throw at just one organization in terms of what he wants to do and how he wants to sort of muddy the waters around industry transformation, as it describes it, saying that it wants to become part of the solution, to be able to approach policymakers independently without having the stigma of being part of the tobacco industry. It's got a new CEO in charge, and I think there's work still to be done to make sure that it isn't allowed to connect with policymakers, and they're actually allowed to, they're made aware of the background to organisations such as the Foundation for a Smoke-Free World and their activities as well. But I think there's that constant need to keep on shining a light and making sure that that information is shared, and that based upon solid research as well, because the industry itself is under a constant stream of being able to look at developing new allies and coming up with new forms of being able to find its feet at the table. And so that's one area that we've been looking at, issues around manipulation of science, thinking about how it's changing its language, how it's using that language amongst allies as well, and where we can sort of track some of those phrases to show where that language is finding its way. So there's a challenge, I think, for us, and I think there's a challenge really also for colleagues perhaps on this call as well, in terms of where else we should be looking at in terms of how to what areas we're looking at, so that people are best equipped to be able to expose, to be able to challenge, to be able to make sure that policymakers are as well briefed as possible. Thinking about both say the legislation proposed for the UK, and making sure that that legislative process is as protected as possible, and even within as well the resource countries in the UK, knowing that nonetheless the industry will be putting every efforts into frustrate and devalue such tobacco control efforts as well. So I'm really interested to sort of hear from comments from colleagues in terms of where we can sort of develop as well and be of most assistance. We've got there some contact details for us, so always happy to follow up afterwards as well. And just a final note to say thanks to those on the call. Today is a release for the UK Tobacco Industry Interference Index, and I know a number of colleagues on this call here worked and supported that, and I pass on my grateful thanks for their hard work and efforts on that. It's a real sign, both the UK chapter, but also the 90 other countries that take part in terms of just that global effort to investigate and monitor and share those findings about tobacco industry interference. So I thank my colleagues on this call for their efforts and support on that, and I hand over back to Alex. Thank you.
Thanks, Phil. A really, really comprehensive overview there of just what we're up against as a tobacco control community. It's one of the perhaps not entirely unique, but almost unique qualities or characteristics of tobacco control work, that there is such an active opponent, and that any gains made need to be actively defended as well to maintain that progress. I would invite people to post any questions they have for any of our panelists in the into the chat. But I might abuse my position as chair by posing the first question. And perhaps to the team at Bath, very much in the forefront of our mind as a global team at Cancer Research UK is the forthcoming COP meeting for the Framework Convention for Tobacco Control. And I wondered if the team at Bath had any reflections on where they think the industry are likely to be most active around the COP in terms of the issues on the table.
Alex, thanks. If I can pick that up, and yeah, we were all sort of geared up and ready to go, and now we've just sort of gone into neutral mode and stuff, and are ready to sort of go up again. And I think that we were certainly carrying out monitoring beforehand in terms where the industry is looking to delegitimize the framework convention, fundamentally to say it's not fit for purpose. This is not for the new age, if you like, and make out as if that is the past and they are the future. I think there's a real tussle about that narrative and who that audience might be. And for those audiences at the in terms of the FCTC at that COP meeting, quite maybe different from some of the policymakers who are not there and perhaps not as engaged or understand the importance. And indeed, I think that the launch of the Global Tobacco Industry Interference Index is one example about showing where we've got a really powerful treaty, but it's only as powerful as its application, if you like. And so I think there are sort of two areas of work. One in terms of those policymakers in country, in terms of making sure that they are signed up to the implication of the treaty, but also protecting that process within COP itself. One of the things we found from last time was that the industry sort of subcontracted a lot of that work to other groups, if you like, and it was relatively silent. They seemed to have been a bit more vocal this time, and PMI was saying quite openly that we've rented this particular hotel in Panama and already sort of, fly in and to disrupt, if you like. But I think there is an emboldened sense there, and that might be about the power of the particular treaty, about how strong they wish to take that on. And I think they will use whatever efforts they can to, as I say, to delegitimize it. There are some aspects coming up around voting around, say, human rights and the environment and liability was looking to be discussed at COP. I think are really important, particularly the nature of the conversation here about inequality and thinking about sort of human rights links and environmental links to it as well. So it still remains such a key treaty, which is why I think the industry is looking to deploy as many different tactics, if you like, to look to undermine that legitimacy. And I think then why that's really important is to keep reminding about why its effectiveness. I tend to assume that they're shouting the loudest. It's probably because it's sort of working, if you like, the screen test as they sort of usually describe it.
Thanks. I wonder if I could sort of put the other side of the coin of that to Nisha, and from a Sri Lankan perspective, and working as you are in country to advance tobacco control. What, how important is the SCTC to you in your work?
Oh, it's been really useful because we have a benchmark to look against, and also the support that we've been getting from Bath and Stop, and technical support, because we don't need to really reinvent the wheel, and it's easier for us to understand why the tobacco industry is doing what they're doing, and then come up with plans to refute that. But I think maybe a bit more awareness, because that incident about the enumerators, we didn't even know that Stop, organizations like Stop can help us before we went to the enumerator, send the enumerators out. So if we had known that beforehand, then we would have taken action when we were training them to build awareness about these things. So I think a little bit more awareness about the work that you're doing would have been really good. And so it's actually been very sort of easy. It makes it very easy for us to do work here, and also to concentrate on, because it's a ongoing battle. It's a series, a war actually. One battle is over, then another one is starting. So, and it's changing, because it's since 2019, when we got support from CRUK, Sri Lanka has had so many challenges, from Easter Sunday bomb attacks to COVID to the economic crisis. So with all of that, the industry has changed and we had to change. So it's been really good to have the support from the FGCT and also from organizations like this.
Thanks, Nisha. And perhaps then, Malcolm, coming to you for the UK context, where does the SCTC sit? It clearly sets a floor rather than a ceiling for aspirations for tobacco control policy, but it also, as Phil mentioned earlier, it also contains provisions around Article 5.3 around the role of the industry and prohibiting its interference in making policy. So where do you see the how much does CRUK actually use the FCTC in its or rely on it in its domestic policy making, and where does it have use?
I see that. I say I don't have the pleasure of working on the coalface of this, but in terms of kind of where I think we see it, one, there is just the standard reminder across, across policy making about this, as you say, is the baseline. Policymakers come and go. We've seen from the last 24 hours, health secretaries in the UK come and go, and public health ministers come and go. There's always that sense of just being able to remind them where this is. But so that's the baseline. I think what we've got quite interestingly at the moment is around the tobacco and vapes bill. So this is on age of sale, but it is also on looking at the proposed potential restrictions on vaping, in terms of particularly making them less accessible and less available to young people, but also in terms of more generally looking at the regulatory environment. And there's a consultation around this at the moment, and there is, I say, a wider, it's understanding and getting people to understand what is coming from, I say, users of these products, what is coming from some of the smaller independent manufacturers and trade associations, and what are actually kind of front groups for the tobacco industry. And there's a role to be played as, I guess, some of the experts in this field, and wading through it, of just being able to tell both the policymakers, the media, and I guess, the educated public to some extent as well, where we feel that the right balance is on that. And I think that's certainly something going forward, because, you know, we know how skilled the tobacco industry is in pretending they're things that they're not, or and getting involved even with lots of different layers of regulation. And my final point was just, we can't be complacent in this country. We had a really substantial, significant, and really great independent report on tobacco control policy last year. It was commissioned by the government, although it was independent, run by Javed Khan. And amongst all the brilliant things that were there, the one issue that wasn't really talked about there was Article 5.3. And so I think, again, it's not to say that that report wouldn't have supported it, but I think it's just that sense of, where does it come when we're talking about these issues? How do we keep it, the importance of this on the agenda? So I think we always have to be mindful of that, and we're not the finished article, excuse the pun.
Great, thanks, Malcolm. And we have a question here from the audience, from Frank and Ziza, who asks, what do you think about the opportunity for African countries as a young continent for tobacco control, as clearly one of the biggest strategies of the tobacco industry is driving addiction to adolescents and children. So I wonder if I could come perhaps first to Nisha to reflect on kind of what the situation is regarding targeting of youth and countermeasures in Sri Lanka, and then perhaps to colleagues from Bath. You know, how do we ensure in African countries, but in low and middle income countries at large, that we're protecting the youth from smoking?
Yeah, so if you look at, if I remember my childhood, I remember all these sporting events, cricket matches, everything. You would see big billboards of tobacco advertising, and people smoking in buses and all of that. But since 2003, since the ratifying FTCT, all of that has disappeared. Now you can't see this bold, open advertising. They can't be involved openly in the sporting events. I think that's the main way they get to the children, young people. And, you know, smoking in public is banned. So with that, actually, we have seen in Sri Lanka, I showed you the statistics have come down quite drastically, especially among the males. But now we have new challenges because of the social media, new ways of advertising, which is more difficult to monitor. And actually, the legal system in Sri Lanka is also not equipped to deal with those things. So there are new challenges coming up. But I think that is the way forward. Actually, I think it gives a lot of avenues for stopping children, saving children from the tobacco epidemic. So, I mean, that's what happened in Sri Lanka. I mean, I could see from my childhood to now how things have changed here. So I think that hope is there for Africa also. They take the same path.
Thanks. Rob, did you want to come in?
Yes, thanks. So I think it's a really important and very good question, Frank. And I would say that children are really important to the tobacco industry because they are smokers who have the maximum possible lifetime, so they can smoke for the longest period of time and hence generate the most profits for the industry. So they are a natural target for the industry to try and reach out to. And so therefore, they're also a natural target for us to reach out to and protect in particular as part of the tobacco control community. And here I'm going to be selfish and going to speak about taxation, because taxation is widely regarded as one of the most effective means of tobacco control. And the simple idea is you tax tobacco products because you make them more expensive. And we know younger people and children especially are the most sensitive to price. So one of the best things we can do to protect children and adolescents is to make tobacco products expensive, because that will just keep them out of the reach. Because yes, we can ban advertising and all those other things which are really important, But equally, we know the industry is very clever at bypassing those by using social media, as we've already talked about. But expensive tobacco is really hard to bypass, because when you have to spend a lot of money to buy a pack of cigarettes, there's not a whole lot you can do to bypass that. So yes, we know the industry tries by selling them as individual sticks. Yes, we know they try to support the illicit market. So if there was one policy that I could push for any and all country, it would be to tax tobacco products heavily, to tax it uniformly, so there aren't these cheaper avenues of smaller, cheaper cigarette sticks like we had reported in Sri Lanka, but also to make sure there are appropriate enforcement mechanisms in place to make sure there aren't these illicit supplies of cheap products that can be sold from under the counter from, you know, individual market stores which still keep tobacco in reach. So use price to protect children would be my big sort of primary suggestion to you, Frank.
Thanks, Rob. That's great. A real clarion call there. You know, I think one of the great things about tobacco control is we do by and large know what needs to be done. You know, it's not a mystery. But it's the challenges in generating that political will to see it through, and these are affordable and cost-effective interventions, you know, spelt out in the FCTC and the Empower measures. So the answer is there. It's in plain sight, but it's still an awful lot of work to be done to get you know, those policies into practice. And as you say, Robert, you know, really important to mention not just the policy, but also the enforcement as well. Indeed, Rob, tax is a win-win policy. Did you want to come back in? Yeah.
So I've just got a related question for Nisha, actually. So I'm sorry if I'm a presenter asking a question, but I was actually really struck by a related line in your presentation, which I think relates to Frank's question. And that was the idea that in Sri Lanka, 68% of people start smoking before the age of 21. Now, on the one hand, that's incredibly shocking because it shows 2/3 of smokers actually start when they're in some way, you know, a junior part of society. But equally, the thing that struck me was that means that 1/3 of smokers still actually started when they were adults. And coming from the UK, that is actually a surprising statistics, because in the UK, even more people start when they were younger. So I just wondered if you had any insight as to why smoking was something that older people also started doing in Sri Lanka. Is it related to income? Is it related to social media and exposure and perhaps trends at different parts of lifetime? I just wonder if there's something there that we should be thinking about. Is it because people need to have a job and more wealth to afford smoking, for example? So I just wondered if there was any insights you could give us there from Sri Lanka's experience as to what are the key triggers as to why people perhaps may start slightly older in life.
So I think probably the answer is all of the above. So as you see in Sri Lanka, you find the smoking prevalence is high now among the rural population, among these low-skilled workers. So you find in the work sites of, say, the construction sites, you see people smoking. So I think all their colleagues also get used to that. And then also this, it's just this cultural, it's a cultural thing, you know, you are sort of more accepted if you are. I think it is something that's been created by, you know, to be cool, you need to be smoking. So, but that's more among the rural population who are not really so much the urban population. So I think they are the ones that are hardest to get through to also, because they're the ones who have access to these informal forms of tobacco, and they are the ones who will buy the single stick tobacco, so they won't see the health warning. So it's actually a bit challenging, and that's something that we've been trying to do, but very difficult because they kind of escape all these different measures, tobacco control measures. They're not exposed to that. So it is more difficult. to get through to them. Yeah.
Great, thank you, Nisha. Unfortunately, Malcolm's had to leave us for some childcare arrangements, talking about protecting the youth. And I think it's perhaps it's time to kind of begin to wrap up our discussion, with great thanks to our panel, and I know it's a conversation that will continue. And indeed, many of us will be at the SCTC hop in Panama, doing what we can to make sure that the agenda stays on track. You know, I think from a reflection from myself as chair, you know, it's really clear that, you know, tobacco drives and is intertwined with health inequalities, both within and between countries. You know, that's as depressing as that is, that it's another tool in our box in terms of trying to generate buy-in from policymakers, that, you know, this is something that has to be grasped. You know, I'm struck also by the commitment, the energy, the expertise that we have in the tobacco control community, and the efforts that are made for us to network and join up our efforts globally in the face of you know, the extraordinary resources that we're facing, that Phil referenced earlier, just with one foundation, with Foundation for a Smoke-Free World. But you know, we are seeing policy gains. You know, Nisha and her team in Sri Lanka have really, you know, done sterling work to help drive tobacco control, tobacco taxation up the agenda in Sri Lanka. You know, the work of CRUK, our domestic team, working with a range of other organisations in the UK, jointly campaigning on tobacco, have managed to seize a moment. Malcolm spoke about the importance of leadership, and I think it's even when it feels like progress is a long way away, things can change very quickly. A moment for leadership can arise, and what's important is to have some really well-formed policy proposals that are there to grasp and implement, to take advantage of those moments. And we've seen from the team at Bath the amount of you know, work, the amount of the networking that goes on to keep on top and shine a light on what the industry is doing, and change perceptions and challenge perceptions of the industry, and how it engages with policymakers as well as in the public sphere. So I think, you know, as we move towards COP, there are undoubtedly challenges ahead, but there's you know, I think we can also reflect on the progress made, the gains that we have to defend, and the gains that we have to still fight for. Perhaps just open up to colleagues if they have any last reflections themselves before we bring today's discussion to a close.
I just want to say thank you for the opportunity to share some of the work, and it's just always really useful to be able to connect and make contact with colleagues here and globally as well, to share information that we have and to learn as well. And I think that's the key thing. I'm always just learning, I think, from these engagements about where we may have to be more effective, thinking about a country or regional level rather than a single global aspect that as a solution. I think just picking up those individual areas, I think, is hugely useful, and I look forward to connecting and working with colleagues on this call in the future. And anybody wishes to make contact, be delighted to be able to assist where we're able to. And I think, as you said, you know, there are gains there, and I think the reason they're putting so much money in is because they know we've got the arguments, and we know that we've got the evidence, and that we know that we've got the movement heading in the way. And I think keeping that sense of optimism is there, I think, is crucial. So I appreciate your clarion call in terms of keeping chipper, because I think, you know, there is a full hands. I looked at the smoking prevalence rates of Sri Lanka, and you think, you know, that where they're sort of moving, you think that's, you know, fantastic sort of efforts. And so, you know, it'd be great to be able to sort of follow those efforts, you know, here and in other countries as well. So it's nice to be revitalized with the conversation I've seen today. Thank you.
Thanks, Phil. Rob, did you want to come in?
Yeah. So I would just add that, you know, we have seen our efforts can be successful. You know, the statistics on Sri Lanka, as Phil has just pointed out, show that, you know, work can be done to make a real difference. And we should be proud of the efforts that we've all put in thus far and the successes we have had. You know, we have collectively as a community saved many lives. But as you said at the very beginning, Alex, there's still a long way to go. There's still these massive health inequalities. And that is where we need to be mindful that the industry is going to go down kicking and screaming. They earn vast profits by selling tobacco products, and they don't want those to go away. So we should not be surprised about all of the interference that we have seen to date and all of the other tactics that they will no doubt bring out in the future as they seek to undermine us. But we should remember that this is a fight we can win. We've got very small resources, and look at what we've done thus far. So we just need to keep going and need to be mindful of what the industry is doing and will do in the future, but don't let it stop us winning the fight, because we need to win the fight to protect people, to give people more years of a healthy life.
Thanks, Rob. Nisha, I think the last word to you.
Yeah, I'm actually really happy that there is so much support from groups like you who have studied what is happening around the world. I think that really give us more strength to fight this battle here in Sri Lanka, because it's not an easy battle, and it is forever changing, and it's very challenging. So it is really good to know that the support is there, and it makes it easier, and it's really been very very good working with all of you. And yeah, I hope to continue, and I just wish you all the strength and success in Panama. Yes.
Thank you so much, Nisha. And thanks everyone for joining today as well. Do keep an eye on CRUK's policy Twitter feed for future events, from updates from COP, and do keep an eye out. I think Phil mentioned the Tobacco Industry Interference Index report has just been launched, and again on Thursday, CRUK will be launching a new paper looking at the impact of tobacco and other cancer risk factors across US, UK, and the BRICS countries. So that's again more evidence and for us to deploy. Thanks everybody. I hope you enjoyed today's session, found it useful, and do look out for other sessions going on during London Global Cancer Week. Thank you.
Thank you.
all.